All right. Well, good morning, everyone. It is 9:02 a.m. on January 17th, 2022. Thank you guys very much for being on the call this morning. As you could probably tell, my camera is not working this morning. I guess it's taken the day off, much like some of our folks here, because it is Martin Luther King Jr. Day. And, although, a lot of services are closed today, we'll be open to help you because we understand that, health insurance is important. And as Dr. King, had an affinity for his community and the people around him. I think we share in that mission. And like we always talk about on every single call, our mission here at Healthline Market is to improve the lives of our community with affordable healthcare. Of course, he did that in another way to improve the lives of his community. So, I hope all of you take a moment today to reflect on that. It is Martin Luther King Jr. weekend, but we are open at Healthline Markets, and we're here to serve the community any way we can. And that also reflects on you. So if you need any services, if you need anything at all, we're here today to help you out, because we understand that sometimes customers, it's their day off, or clients, and they might need your help outside of the normal day-to-day activities. So we're here to help. So with that, we'll jump into our training calendar. So just as a reminder, if you don't have the training calendar on your phone, laptop, or iPad, please reach out to us so we can get that connected, and so you can see exactly what we're seeing out in the marketplace as well. So here's our training calendar for the week. Not much going on today, but on today at 4 o'clock, Humana is doing a care highlights with CenterWell. And CenterWell is one of the doctor groups that we are working closely with across the country. They're in 7 or 8 markets in the east and southwest area and southeast area of the U.S. So if you are looking for a doctor to work with, this would be a great opportunity to jump on that training as they talk more and more about how they're integrating with brokers. And you're going to see a lot more of that throughout the season here of OEP and going into lock-in as well. Moving on to tomorrow, Devoted is doing an open training session at 11 a.m. Again, the training calendar, all you have to do is go in there and click the meeting at the start time, and you're in. So that's for Devoted. If you are not selling Devoted, that's okay. You can just reach out to us, and we'll be glad to add that product to your portfolio at any time. That goes pretty much for anybody, okay? So if you are looking for specific products, just let us know, and we'll get you connected. Moving on to Wednesday, Cigna open enrollment training is there. So I'm hoping that everybody's gotten the training, the basic trainings for open enrollment for Medicare. But if you haven't, it's not too late. That's on Wednesday at 10 a.m. It's hosted by Cigna, so they're going to be talking a lot about their products specifically in OEP. But remember, Cigna is 5 stars if you're in Florida anyway. So if you're in Florida, you got a 5-star plan that you can sell year-round. You do not need an election period. I'm getting a lot of calls about PDPs and, hey, what do I do about this situation? And I said, you guys are forgetting 5-star. So I think it kind of slips our mind sometimes. So, if the product lines up well, you've got a 5-star designation and you can enroll year-round. Okay. Now, just keep in mind you can only use it one time. So if they enroll in Care Plus, or then they jump into Cigna, and you've used 5-star, you can only use it one time. So if you use it for Care Plus, it's done. You can't use it again. So just keep that in mind. Okay. Also on Wednesday at 3:30, Devoted's doing another training for Medicare Advantage. There's a meeting there. Again, you could just jump in there. It is virtual, so you can do that. Also on Wednesday at 4 o'clock, Cigna is doing training specifically for low income subsidy. And I talk a lot about this because this was a great way for me to generate leads, is by becoming an expert in low income subsidy. Low income subsidy is the program that can save up to 95% of the cost of your medications for your Medicare Advantage members. Okay. Really important to know. Okay. It can help your clients save hundreds and thousands of dollars. Hundreds or thousands of dollars. And for those folks that you help, you will also see referrals. Okay. So if you are looking to grow your business, this is an excellent way to do that. Okay. So that is on 4 o'clock on Wednesday. Then on 4 o'clock on Wednesday, also, if you're going to have to choose which training you want to do there, Optum Agent Training Academy. So if you are looking for doctors to work with, okay, you need to meet them. You need to go to their training. Some provider groups, some doctors' offices like Optum, before you start doing events with them, before you start working with them, you need to go through one of their academies. And that's for Optum and WellMed. And I think a lot of other doctors and provider groups are going to start following in that suit. So make sure that you are getting into these trainings, getting them out of the way, because that's how you're going to meet these groups, the marketing reps, the doctors. So very important to do that. All right, that's on Wednesday at 4 o'clock. Jumping over to Thursday at 10, there's another training there for Cigna, LIS. Also on Thursday, the 20th, 11:30, Devoted's doing a coffee and chat session. This one's for Jacksonville, but all are welcome. So if you have general questions, you can jump on there. Simply Healthcare is really picking up steam here. They've got a lot of marketing opportunities and what I like to call an open wallet for you. So that means if you are interested in doing events or seminars or marketing ideas, bring them to us, and Simply is willing to sponsor a lot of these efforts. So Simply Healthcare, they're doing a face-to-face training at 1 o'clock on Thursday. It is not mandatory. If you're first coming on board with Simply, you do have to do a face-to-face training. It is online. So again, the link is in the training calendar there. So if you are interested in jumping in to do Simply Healthcare, if you're considering it, they're a little backwards. They require you to do the face-to-face training before you fill out the contract. So you can go ahead and do your face-to-face training early and get that out of the way. And again, so that's Thursday at 1 o'clock. Great D-SNP products, great HMO products, excellent marketing, owned by Anthem, a billion-dollar company. These guys aren't going anywhere, right? So take a look at their product, and they've got their training there on Thursday at 1 o'clock. 2 o'clock on Thursday, working with providers. I believe that's with Nick. You've got the training notes there. That's 2 o'clock on Thursday. So if you are looking for help, not quite grasping the provider, or you need some help with strategy, hey, I want to work with more doctors, or I'm not making traction with the doctors. Great training to be on. Special event for our Florida agents, Central Florida agents. If you are offering Florida Blue or are considering Florida Blue, they are doing a happy hour with us in Winter Park at 4 o'clock on Thursday. This is at Booyah Gastro Bar. And this is just a soiree, nothing really special there, but a great way to meet the Florida Blue team and get your questions answered. And again, opportunities. This is where you're going to be able to get in with Florida Blue and, have your voice heard. And we're going to talk about that in a minute. And basically just, get to rub elbows with the sales managers and whatever you might need there. So that is at 4 o'clock on Thursday. Plus, it's nice to go to a happy hour from time to time, right? All right. And then we're off to Friday. Friday, there's another Medicare Advantage training with Devoted. That's at 9 o'clock. So if you want to refresh or you're new to Devoted, there's one there. And then last training for the week is Cigna's OEP training we mentioned before. They're doing another one 4 o'clock on Friday. Now, every day in the training calendar, you're going to see at 8 o'clock the HPM Shop 2022 link for the online YouTube training video. Now, we are looking to set up some live trainings here very, very shortly. So we will have those hosted on the training calendar as well, probably once a week with us. So this is our quote and enroll tool for Medicare Advantage. This will change your life. If you're not using this, you are missing the boat. I cannot stress that enough. It is literally saving a lot of time for a lot of agents, and they are very, very happy that they learned the software system. So take the time to do so. All right, that is the training for the week, and we're off to the next thing. Most recently, I sent several of you a feedback survey, a form that we are asking you guys to complete. Now, some of you will get a phone call from Kim this week asking you to complete that. We sent it out last week, I think almost a week ago. and we haven't had much luck in your participation. We need your voice. We need your feedback, okay? This is your chance to really let us have it. Where are we messing up? What are we doing right? Because if we don't know what we're doing right and we change it, then we're kind of getting ourselves in the weeds there. But if we're not doing something right, we need to know. Or if there's a better idea or you have a suggestion, this is your time to make your voice heard. Please don't underestimate this, because if you are looking to help us improve the service here at Health Plan Markets, if you want better service, if you want more products, if you want other ways of doing this business, we need to know which way to go. Okay. So please, please, please fill out that form. It will take you less than 5 minutes. And we're looking forward to hearing your feedback. We'd like to get that together because on Friday, on our team meetings, we'd like to be able to discuss a lot of those results so we can start taking action. Okay. So again, if you're wanting to help us, improve the service here, if you're wanting to see something change at Health Plan Markets, this is your time to tell us what that is. Okay. So just check your email. I sent text messages as well. If you did not receive it, just reach out to one of us and we'll be glad to send it over to you. Okay. All right. We were talking about Cigna a little bit earlier today, but Cigna does have a contest running now. I believe it's for the Florida market, but if you're in another market like Georgia or California or wherever you might be in the world, and you have Cigna in your backyard, please reach out to us to see if this contest is available in your area. But this is for sure in Florida. They're calling it the 5 for 5. So for effective days 2-1, 3-1, or 4-1. Okay, so we're writing right now for 2-1. So for the rest of OEP, okay, 2-1, 3-1s, or 4-1s. Then if you write 5 policies, a minimum of 5 policies, you will get a $500 marketing check. Okay, so this is, not commission. It's a $500 marketing check that is available to you to reimburse you for gas or events or mailers or flyers or business cards or whatever it is that you're spending money on to promote yourself. You're going to get a $500 check from Cigna. Now, that's the minimum, is 5 for 500, but it doesn't stop. Okay, so if you write 10 in that time frame for 2-1s, 3-1s, or 4-1s, there's $1,000 for you for marketing. Okay, this is coming directly from Cigna. We have nothing to do with it. They're just rolling out this contest. And again, this is for Florida market, but if you are in another market and looking to see something similar, we'll reach out to management there and see if there's something out there for you. But as of right now, this is coming directly from Cigna. It's a 5 for 500. Check your email. They sent that over. I think Randy sent that over on the 10th of January. So for more information, you can reach out to Cigna directly. But again, if this is for the Florida market, if it's not in your area, you can reach out to your Cigna rep manager, and they'll be able to share that information and see if it's available for you as well. But just wanted to make sure that you guys were aware of that, because I hate it when, I hear like, oh, I didn't know they were in a contest and I was only one short. That just kills me. So I get it when that happens. All right, so marketplace, we're shifting over real quick into the marketplace. We did have open enrollment end on Friday, January 15th. And so we are now, it's Saturday. And right now, I wanted to share some stats with you guys because this has been a historic open enrollment. Now, these stats that I'm showing you here are fresh, but this didn't capture the entire open enrollment because this came out last week, right before open enrollment ended. So take a look at these stats here. A record-breaking 13.8 million Americans enrolled during open enrollment, and they did that through healthcare.gov, and whether you used Health Sherpa, which is our preferred platform, or they went through the state-based marketplace. So if you're in California, you went through Covered CA, so you have to use their state-based marketplace. But overall, 13.8 million people enrolled. This is the highest enrollment season that we've ever had. Okay, so it's pretty much here to stay, guys. Whether you call it Obamacare or ACA or IFP, individual and family plans, this is not going away. So and just a couple more stats here. Over 9.7 million people enrolled through healthcare.gov, and 4 million of those, 4 million other people enrolled through the state-based marketplace. So the state-based marketplaces may start to, transition there. So we have the federal enrollment site through healthcare.gov, and then you have your state-based marketplaces where the actual state kind of controls that. So if you're in a state-based marketplace, you've got over 4 million people that use that as well. Now, 4 times the number of navigators, there's over 1,500 of them are enrolling people. Now, these are not licensed agents. These are navigators. So they have a job, right? And they're usually located in a call center. And so they hired 4 times as many this year. So that's just an indicator right now that there is a lot of business to write for individual and family plans. So if you're not doing ACA, if you're not doing Obamacare, if you're not doing any of that, you are missing it. The commissions are outstanding on the agent side. I'm very, very jealous of what these guys are making these days. They've got bonuses. I mean, unreal stuff. And it's not hard to learn, and it's not hard to do the business. Okay. But here's something else I wanted to share with you. The American Rescue Plan and the enhanced tax credits have led to record-setting savings for people across the country. So that American Rescue Plan is helping in the ACA products, and it is making a difference in the enrollment sites. Okay. The American Rescue Plan cut premiums by an average of $50 per person per month. That's a big savings. So if you were paying $200 last year, you're looking at about $150 this year. So big money on that, $600 a year, right? 4 out of 5 consumers can find a plan for $10 or less per month. Now, of course, that comes with subsidies and all that other stuff. But open enrollment has now ended. But I'm bringing this up because if you miss the boat here, open enrollment's going to start again in November for sure. You're going to have SEPs. This is a great time of year to learn ACA. And we're going to be putting out training sessions and, again, hopefully having live sessions once a week to help you train on ACA and get going on that. I don't want anybody missing the boat on those types of things because it is a fantastic time to be doing that business. All right. So let's talk about what you guys should be doing right now. It's January 17th. It's halfway through January. Hopefully you guys got a little bit of rest in and you are recovered from annual enrollment period and open enrollment period. Those of you that have been slinging for ACA, this was the first weekend where you got to breathe. So I get it if you need a little bit more time to breathe, but don't lose your pace. Don't lose your groove. We want to keep you moving. So what should you be doing right now? Okay. The number one thing that you should be doing right now this week, or even for this month entirely, is talking to your book of business. Okay. Your book of business is what's keeping you alive. It is the paying your bills for you. These are your customers, right? So we want to reach out to them, and you really, really want to build a relationship. So what you should be doing right now is contacting your members. Okay. Now, Humana put out this 3, 30, 60, 90-day conversation guide. And I get this question a lot, hey, Justin, I'm calling my members, but I really don't know what to talk about. I'm kind of lost in conversation. I'm not really great with that. I get it. A couple of bullet points don't hurt. But Humana sent out this 3, 30, 60, 90-day conversation guide. You can download it from your portal at Humana. If you check your emails, they sent it last week, I believe, and it's down there in the Ignite newsletter. So you'll see 3, 30, 60, 90-day conversation guide. And I want to touch base on this just a little bit because throughout this guide, it's got these conversations, right? One of the biggest pieces you're going to take away from this is how to generate referrals. Okay. Referrals, no matter how much money we spend every year in marketing, advertising, all the crazy stuff that we do as a broker, as an agent, our number one lead source every year is client referrals. But it starts with you, and it starts with the conversation and the relationship with your members. Okay. Now, it does talk about the surveys and how you can help them with their HEDIS and CAP scores. And that helps your providers and keeps those star ratings up, because we all want a 5-star plan in our backyard, but we play a role in that more than you know. Okay. It's not just the doctors and the health plans and the hospitals that are controlling these star ratings. It's you as an agent, and it starts with you. So I would definitely, pay attention to that. There's some great videos on, what you should be doing as a Humana agent, but just some great stuff in general. So take a look at that. Go through the retention piece of this, because all that hard work that you did, this is how you're going to retain your members. Okay. Your retention efforts start today, but they never end. Okay. You should always be thinking about, how do I keep my members happy? Okay. The number one reason why people change a product or service, the number one reason a person changes a product or service is because they simply did not feel appreciated. That's it. It's not the customer service. It's not the product itself. It's not even you. It's just because they didn't feel appreciated. This is your chance to help them feel appreciated. Okay. Now, in this guide, it'll also go through different strategies on how you're contacting your members, everything from digital, best practices from a compliance aspect, how to stay relevant, language preferences, what channel to use for which media, all sorts of great stuff in this guide. So definitely a great tool to use. I would definitely print this out and hang out and read that at your leisure, because I really do think it's got a lot of power behind it, but that's there for you. So with that, guys, we have a shorter call today. We do really appreciate everyone being on the call today. And by the way, Tom's got this in the Gold Key. He's been putting all this great stuff in the Gold Key as well. The conversation guide, the 330, 60, 90-day campaign. So if you're using the Gold Key, Tom's got it in there too. Thanks, Tom, for the reminder. But again, so if you have any suggestions for calls, please let us know. I'm happy to add them in. If you see a topic or something that you'd like to hear on these calls, we'd be glad to cover it for you as well. Again, happy MLK Day. I hope everyone is safe, and go out there and help our community just like he did. We really do appreciate your partnership at Health Plan Markets. I hope everyone has a fantastic week. And if you need anything, you guys know where to find us. Thanks and take care.